You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Welcome to another episode of the RN Mentor podcast. Today we're going to be talking about the Nursing Mutual Aid 2020, a conference that's been put together in light of the current COVID-19 situation and the fact that many of us have had conferences canceled and presentations canceled, podium presentations canceled. So as a result, a group of incredible nurses have had the foresight to put something together in the virtual world of Twitter. So using social media as a conduit to still get information out and give us an opportunity to share the science of nursing on all levels. So today's guest, we have Dr. Rachel Walker. Dr. Walker is currently an associate professor, nursing PhD program director, and associate director of the UMass Amherst Center for Health and Human Performance. And we have Dr. Ana Valdez, who currently serves as faculty at Santa Rosa Junior College, Sonoma State University, and Walden University. And she is currently serving as the editor-in-chief for the Teaching and Learning in Nursing Journal. Dr. Walker and Dr. Valdez are part of the incredible team that put the Nursing Mutual Aid 2020 together, and their full bios can be found on my website at www.alirtayeb.com, which is linked to this podcast. Now I would like to welcome Dr. Rachel Walker and Dr. Ana Valdez to the RN Mentor podcast. They are two of the creators and organizers of the Nursing Mutual Aid 2020, which is basically a virtual conference for all of us that were displaced at some point because of COVID-19. So with that said, I'm going to start off again with a welcome, and please take it away. How did this whole thing come about? Where did the idea generate, and how did it get started? Dr. Walker?
Well, it's most definitely been a collective effort that continues to grow. And I think that is our hope, that while we're having a conference on April 30th on Twitter, which we hope will be open access and inclusive and accessible, the purpose of mutual aid is really around radical solidarity and community building. And I think that's where folks who've gotten involved have really found the most inspiration and space for imagining sort of new futures for how we collaborate and come together and amplify, or perhaps more importantly, pass the mic to folks within our communities, within nursing and midwifery, among students, particularly those who may be often pushed to the margins by the dominant powers of society, to hear their perspectives, to learn how we are all nursing the community in the context of COVID, and to share, resources, opportunities, calls to action. We started out with a tweet that went out to nurse Twitter around, hey, is there some way as we were seeing more and more of the conferences and other events canceled several weeks ago now, as COVID was really just starting to kind of take off in the U.S., is there some way we could come together virtually and support each other and share that knowledge that's been canceled by COVID? But when these amazing nurses and midwives and students came together for the first time and we really talked about what was happening, where we were, how it was both impacting us and people we care about and the communities we served, we realized this needed to be more than just a space to share sort of knowledge and presentations, though they're important. It wasn't just an academic conference we needed. It was really community. And it was a way to connect people at a time of social distancing when many of us also are feeling isolated, are managing new challenges perhaps that we've never had to really face before, and are all wondering, what is it we can do? How can we offer support to each other? And also, how can we get our own needs met? So that is where sort of mutual aid was born as a concept for both a conference, but also a platform, a digital space, and we hope a community that may continue to grow, that can continue to support each other and maybe ideally not just respond to need, but fundamentally transform some of these broken, not even just broken systems, but structures that are currently preventing us from nursing the community the way that we know we need to. And I think Dr. Valdez has seen that too.
Yeah, I have. One of the things that I found to be really exciting about this process is, one, it's been a very collaborative process. There's not a leader in the group. We all work together, we collaborate, we develop consensus. I have learned a tremendous amount just through the collaboration process and having the opportunity to work with a bunch of really brilliant nurses and scholars. And I think it's allowed us the opportunity to really look at who are experts, right? Who are experts in nursing, and how do we share those voices? Many times the voices that you see at presentations or you see in publications are people who are perceived to be experts because they're scholars and they've moved their way up and they've been highlighted, right? And so they get invited to be presenters again, and they're recognized, and that excludes a lot of important voices. It excludes experts, and it limits the way in which we view experts. Right now, we have nurses at the stretcher side, at the bedside, who are experts in COVID-19. They know more than I know. They know more than most scholars out there, and their voices need to be amplified. And we have people who are experiencing disparities and care, who are experiencing COVID-19. They are experts. And so I think it's helping us to reshape and reimagine who is an expert in nursing, and how do we share information, and how do we do just-in-time education. Never before as a nurse educator have I been pushed or extended this much to do just-in-time, real-time education and research. And so I have found this very exciting because we are not limiting this platform to people who are well-known scholars. We certainly welcome those voices. We certainly welcome researchers and people who are, beyond early career research. But we also welcome voices that are silenced often, and people who are experts in other ways. And we also welcome diverse ways in which to share information. So we've not limited it to you have to have this type of presentation. They can have slides if they want. They can have GIFs if they want. They can have pictures. They can share poetry. There are many ways in which the nurses who participate can communicate and share about their expertise. And that's one of the things that I find so exciting about this. And I also think it's the first time in my almost 30 years being a nurse that I've been able to participate in a global conference where anybody in the world could hear the speakers, who could hear the presentations, who could, if they couldn't attend at that time, can go back to those presentations. So not only am I excited about opening up a platform where all experts and all voices are able to share their knowledge, but people all across the world, including journalists and scientists in other countries, will have access to that information and be able to share it. So for me, it's been very exciting and transformational.
And thank you for that. I mean, one of the main things that I saw when I first started the conversation, I started seeing the conversation on Twitter. I was getting excited about the fact that this is coming, and when I saw it actually come to be, one of my biggest issues has always been the equity in conferences, right? From a cost perspective, from a location perspective, who the bias that I know exists within publication and conferences, unfortunately. So to open it up to so many people, to such a diverse community of nursing that are doing incredible work out there, from bedside all the way to academia to policymakers. So that's one of the main things I was excited about, because it's really, it's not about making money. It's really purely sharing information. And that's what was very appealing to me when I saw this happen. So I saw you guys have a very rich group of individuals that you've put together. How did that collaboration happen?
Oh, that's the beauty of nurse Twitter. Or nursing and midwifery Twitter. I think there was a sudden surge of folks when this started to develop as a discussion on Twitter, which, as you mentioned, it's free, it's open access. Yeah, you can tweet in any language and then instantly translate it, so that hopefully is not as much of a barrier. So folks came together, and we have midwives, we have nurses, we have people with acute care backgrounds, we have nurse journalists, we have policymakers, we have activists and organizers. And I think we've tried hard to, no group is a monolith, of course, and there are so many different forms of intersectionality that can exist in the world, but to try as much as we can to ensure that folks who are collectively leading this effort represent a wide variety of positionalities, perspectives, backgrounds, and even time zones, because we recognize I'm an East Coaster. there's a bias there too sometimes. When you have an event start at 7 a.m. Eastern time, that excludes a bunch of folks on the West Coast and also in many parts of the world. So being forced to think about that. And I think we've, as Dr. Valdez mentioned, all been learning from each other. At least I know I've been sort of learning and unlearning on a regular basis, which is the beauty of a collective where you have a certain degree of trust with each other, that each person is showing up as an expert in their own lived experience. And that when someone throws out an idea, that's coming from an authentic place. And sometimes we don't all have the same ideas. We've had some vigorous discussions, even around the choice of the term mutual aid, which is not a new term. It's a term that has long historical roots in community activism, going back. I think maybe one of the most famous examples is the Black Panther Party in the late 60s and 70s, who organized for their communities to meet their needs directly when they didn't see the government and other folks in power doing that. They offered free clinics, free breakfast, and there have been many, many organizers and activists and scholars who followed in that vein since. Right before I got on this call with you all, I was listening in on the Data for Black Lives Pulse Check, which is another organization that has come together to meet really critical needs, particularly of communities of color that are not seeing themselves being counted, that are not seeing the algorithms that currently run the world do right by them. And they were also noting this whole upswelling as of late of mutual aid that's occurring not as charity, but as the organizer and founder of the Sylvia Rivera Law Project, Dean Spade calls, it's solidarity, not charity. It's about communities coming together really to survive and to meet their immediate needs in ways that aren't being served by the current structures. And while many of us among the organizers do have various forms of privilege that we benefit from, myself, I'm an abled white academic. I have many things that protect me from aspects of life that others really don't enjoy that protection from. I think that we're mindful that even as we occupy some of those positionalities and privilege, we also are seeing acute needs, among ourselves and among the folks that we care very deeply about, and that we cannot wait to meet them. We cannot wait for the establishment, even of nursing and midwifery. Our professional organizations, they do great work, but we cannot wait for all of them to get on board with responding. This is an all hands on deck kind of situation. And that's often when you see mutual aid sprout up, is in these moments that can be terrifying, but also, as Dr. Valdez mentioned, transformative. We can create new futures, if we're willing.
And that's one of the beauties of, I think, you doing this, is the fact that there's really no boundaries for you, like there may be for organizations with policies and regulations, and have everybody and their mother sort of have to approve it before they can move forward. You're a collective of very intelligent individuals that have seen a need for it and have filled that need. And actually, I think I want to say it happened. I feel like it happened in a week that you put this together. It was I saw a tweet about what do you think, and then I saw another tweet. Here's the website. I think that's basically.
That's the power of a collective.
Yeah,
I think Dr. Valdez can speak to that too.
Absolutely. I think it is the power of a collective. We are really privileged. Dr. Walker and I are here speaking with you, but there's a whole team of people who have been working. And I would encourage people who listen to this podcast to go to our website at nursingmutualaid.squarespace.com and look at our organizing team. We have been meeting regularly, we communicate regularly, and everybody is volunteering and working hard to make this happen quickly, which has been phenomenal. And again, it allows us to do things that are no cost. There's no cost to participate. There's no cost to present because we don't have any overhead or cost. We're all doing volunteer work to be able to make this happen. And I think also it's a group of nurses and midwives who are very committed to equity and justice and open access and accessibility and inclusion. And therefore, we approach this with that mindset. We've been able to, challenge our own biases and have really healthy discussions about what we're trying to do to make sure that this platform is really accessible to everybody. And I, too, am very impressed by how fast we've been able to move, but it's a very high-functioning group who are all in and really want to see this happen. And I think we're all very invested in this concept of mutual aid and solidarity. Solidarity with our nurse colleagues, our other healthcare colleagues out there, and also our patients and communities. I think it's a sense of radical solidarity that I really appreciate, and I am hoping and I think will shine through in this conference.
To that end, too, in terms of sort of groups, communities that have been historically and currently marginalized in much of nursing, midwifery, and just larger society, some of the intentionality of the collective in terms of making sure that we have some representation within what the conference, and we hope, the community of these groups, whether that's carceral nursing, whether that's migrant health and justice, environmental justice, school nursing, which often gets much less attention than it should, reproductive justice, disability advocacy and justice, LGBTQ plus perspectives, the perspectives of Black, Indigenous, and persons of color, really making sure that we center those individuals and those voices, because we don't know what we don't know. And again, we're always learning, but they are the experts in not just how to solve problems, but what the problems are that we should be attempting to solve, or at least throwing our weight behind collectively to support where we can. And I think as this continues, we hope that it will lead to more events and actions and transformation in the future that isn't just limited either to like the collective, like the organizing team that's currently on our website. There's some pragmatics to that. Like you can only have so many Zoom boxes going at one time and you're trying to plan. But we really hope, I think, that this continues, that perhaps organically we can bring more and more folks into this space, and perhaps like other groups, like the Design Justice Network, like Data for Black Lives, maybe we might even eventually have nodes, the West Coast node and the East Coast node and the, Brazil node. I think we've got a presenter joining us with a Brazilian background. So that's something that we hope we will make space for if people want it to happen.
And I have to thank you because you guys went ahead, went one step further and included faculty and students. You gave them a tool for them to actually participate as not only presenters, which is usually how students end up at conferences, is because they're presenting, but you gave them a door for them to walk through and actually go to a conference at no charge, and actually be exposed to many presentations. Actually, I'm going to have a nice number of my students that are going to be attending. Most of them have never been on Twitter, so there's going to be a learning curve for them. But I saw that. I'm like, yeah, my students, hey, guess what? We're not doing Zoom. You're going to a conference. That's what's going to happen. So thank you for actually opening that avenue, because like I said, most students do not go to conferences. When I talk to my students, as I'm sure you do too, many of them don't go to conference. Actually, a lot of nurses don't go to conferences. They do their CEs and that's where it ends. But so getting more and more people out there that are exposed to the topics you're talking about, it's amazing. It's amazing.
Yeah. And part of information sharing, I think, in nursing is the restriction of having to travel to a conference, having to pay for a conference. I have to be selective about how many conferences I can go to, and I have the privilege of having a high income and secure employment to be able to support me. And so I think especially for students, it is very difficult for them to be able to get to go to conferences. They're trying to pay for school, they're working often, they're doing their schoolwork. And so we were very excited about opening this up. I'm delighted to hear your students are going to participate. Some of my FNP students have applied to present and will be attending. And we've sent this out to students all across the world and hope that they will participate. And we wanted to make it as easy as possible. So on our website, which it sounds like you have already seen, there is a letter for faculty and students explaining how this conference will map to the AACN essentials from the, associate degree to doctoral level. And we created a form to make it really easy where students can log what presentations they engaged in and how much time they spent, and included some information about how they could journal about that or summarize it, which is in Word format on purpose so that faculty could alter that and make it fit their particular class or their particular class outcomes. So I'm excited to hear that you are sharing that with your students and encouraging them to participate.
Yeah, actually, we're using it or I'm using it as a way to give clinical hours, since so many of the clinicals are no longer, they've been canceled or people have been displaced. So I'm giving them actually 15 minutes per presentation. So with a maximum of 4 hours, so they can sit through 16 presentations and get credit for it. So that's
you
kind of
just
how
made our day.
You did. That's our
That
hope.
is exactly what we were hoping.
Yeah. So I said
our.
Go ahead.
I was just going to say, our on the subject of conferences and inclusion, the students, whether they're pre-licensure students, RN to BS students, graduate students, postdoctoral fellows, we really, really do hope students will participate. Part of the intention behind the submission form, which is on our website on the landing page, right up in the right-hand corner, it can take definitely less than 5 minutes, maybe 2 minutes if you're speedy to fill out. And it really does leave a lot of space, I think, for what you can bring in terms of your expertise and lived experience. Because we also know with some of the radical policy changes that have happened lately due to COVID, that students have been placed in a really unprecedented position, whether it's having to complete their clinical semesters completely online or through alternative formats, whether it's being told that now they can practice unlicensed in some space in the context of a pandemic crisis. The students are our future, and they're also in an extremely vulnerable position. And as many as are willing and able to share any of their perspectives, we would love to have them engage as presenters in addition to participants, acknowledging that power and vulnerability may mean that for some that's not possible to engage as fully as a presenter as they might like to. But if they have that interest, there really is just so much support among the organizers, and willingness to work with folks too. If Twitter's not comfortable or familiar to them, if they've never tweeted before, if they're still trying to wrap their head around what a tweeted presentation might look like, we've had some very generous members of our organizing group, including Dr. Valdez, who've offered to help work with people directly to get them to where they feel like they can do that, or where even in some cases we might help to facilitate that. We really don't want the Twitter aspect to be a barrier to participation.
And I saw you on your website, you had a resource page on how to do Twitter stuff. You have a fantastic infographic right there that I noticed somebody put together.
Marion Leary.
Okay.
Who is another fantastic member of the organizing group and a media whiz, bar none.
Yeah, so I saw those things. So I've been sharing those regularly with our faculty. So I don't know what other faculty are doing, but yeah, definitely, I think it's well worth it for somebody to, like I said, get out of their comfort zone if they need to and do something different. Looks like a lot of us are doing that these days. All right, fantastic. So thank you again for doing this. If you want to give another shout out to where they can find you, I'm going to put your website and the information on my link for the podcast. But if you want to speak to that real quick.
Yes, please. So our website is nursingmutualaid.squarespace.com. And one of the things to note is up in the left-hand corner where our hashtag is there's a menu area. If they hover over that, it opens up several pages. So that's where they can find the nursing student and faculty information, how and why nurses should use Twitter, how you would participate in a Twitter conference, our infographic, and all of the Twitter handles for conference organizers. And for those people who have expertise to share, have a story to tell, want to be able to present, but feel intimidated by Twitter, we would say, please don't take a look at the resources, reach out to us. We will help you to figure out how to use Twitter, how you might organize, your information into 6 tweets or whatever support they need. We want to make sure that this is as inclusive as possible. And I also wanted to mention that it's accessible too. So one of the things that we have asked of all presenters is a commitment that their material will be accessible. So for instance, if they wanted to include a video, that it be captioned, or if they're providing other materials, that those are all accessible materials.
Yeah, and we do have tutorials on the website for folks to work through how that might apply to their presentation, whether that's using descriptive text on images. So again, they can be translated or sort of read aloud through an e-reader for those who might need that. And with your permission, I'd just like to name the rest of the organizing group because they have worked so very hard on this. And it's certainly not limited to them, but as long as we're here. So, of course, Dr. Valdez. We also have Wanda Montalvo, Jessica Dillard-Wright, Barbara Glickstein, of course, of the Woodhull Revisited study, amazing nurse journalist, Robin Cogan, the relentless school nurse, Monica Mucklemore, who I feel almost doesn't need an introduction, Anne-Marie Morides, who is a doctoral student, M. Rob Lay at UIC, Jan Kaminsky, and Marion Leary, who, of course, as you mentioned, designed that wonderful infographic and has also been helping us spread the word.
Fantastic. Thank you so much. And actually, I've hit some of them up for future podcasts. So so definitely, and I'm privileged enough to know a couple of those in that list. And it's like I said, you guys put together an incredible group. And I think we should definitely mention it's going to be on the 30th of April, correct? I don't think we mentioned that.
30th. So the submission site is open until Monday, April 20th. So we are still seeking folks who would like to present. And we have a really exciting lineup so far of those who've already thrown their hat into the ring, so to speak. And we're hoping to be announcing some of the already accepted presentations and people will be welcoming later this week.
Fantastic. And the hashtag for those who are just going to end up showing up on the 30th on Twitter will be hashtag NMA2020, correct?
Right. NMA as in Nursing Mutual Aid 2020. So if you find that hashtag on Twitter, you can hopefully follow the conference. You should also, if you're interested, follow the Twitter handle for the conference. That's it's titled Nursing Mutual Aid, and the handle is at NRSG Mutual Aid, all one word. So it looks like Nursing Mutual Aid, a little bit abbreviated at the top. And if you follow that handle, you'll be able to follow all of the presentations. And again, if you miss it, because maybe you're out there delivering direct care right now, maybe you're looking after, loved ones and family members, you can always go back, access the presentations, ask your questions, comment on the threads, and our hope is that the presenters themselves will still be able to engage with that, whether it's on the day of the conference, which is April 30th, it's a Thursday, or later in time.
Dr. Walker, Dr. Valdez, is there anything more you'd like to share about the website or the conference?
So the whole point of the digital platform, right? Community building, solidarity, hearing voices, but also on the website, there is an entire space on the website, a separate tab. It's labeled Mutual Aid Resources. There we have a running list that is crowdsourced from folks who are participating with us on this platform of all the spaces you can also check out, either opportunities to engage in mutual aid resources or other calls to action, which may be relevant to your practice.
Outstanding. Thank you. So thank you again. So again, the Nursing Mutual Aid 2020 will be happening on Twitter on the 30th of April, 2020. I will have links to your site on my website, and it will be, the podcast will be on my website and on Apple Podcasts. You have been listening to the RN Mentor podcast with our guests, Dr. Rachel Walker and Dr. Anna Valdez, speaking about the Nursing Mutual Aid 2020 that will be happening this coming 30th of April, and we look forward to seeing you on Twitter. Please be safe, and it's been a pleasure sharing this time with you. Until next time. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources, and don't forget to subscribe. Until next time, I wish you fair winds and following seas.